Welcome to The Explainer. So, what if your skin and your skeleton decided to declare war on your body at the exact same time? Today, we're pulling back the curtain on a rare and really mysterious condition that does just that: SAPHO Syndrome. Okay, let's dive right in. For years, doctors have been pretty stumped by this medical enigma. You've got a patient who shows up with a really severe skin condition, but at the same time, they're complaining about this deep, aching pain in their bones. It's almost like the skin and the skeleton are in cahoots, coordinating an attack on the body. Just try and put yourself in the patient's shoes for a second. You're dealing with a relentless, painful skin condition. Maybe it's severe, disfiguring acne or these painful pustules on your hands and feet. And then on top of all that, you have this gnawing, inflammatory pain deep inside your bones, especially in your chest. It's so easy to see why you and your doctors would think these are two totally separate problems. But what if they aren't?
And this is where the medical mystery really gets complicated. The patient goes to a dermatologist for their skin, and then they see a rheumatologist for their bone pain. Each specialist is looking at the problem through their own kind of narrow lens. It's like two detectives investigating different crime scenes without ever realizing they're connected. And that, as you can imagine, can lead to a long, frustrating search for answers.
So, for decades, this puzzle just remained unsolved. But then, in 1987, a rheumatologist named Shamat and his team had a major breakthrough. They figured out that these seemingly unrelated symptoms were actually all part of the same condition. So they gave it a name, an acronym that would finally start to bring all the pieces of this puzzle together. That name is SAPHO. And it's not just a name, it's basically a key that unlocks the whole mystery. You see, each letter in SAPHO stands for one of the 5 core symptoms of the syndrome. Think of it like a medical acronym that tells a story: Synovitis, acne, pustulosis, hyperostosis, and osteitis. Okay, let's break down these clues. First up, S is for synovitis. That's a painful inflammation of the lining inside your joints, the stuff that keeps them moving smoothly. A is for acne. But we are not talking about a few pimples here. No, we're talking about the severe, deep, often scarring kinds. Then P is for pustulosis, which causes these really painful pus-filled blisters, usually on the palms of your hands and the soles of your feet. And finally, you've got the bone issues. H for hyperostosis, which is an abnormal overgrowth of bone tissue, and O for osteitis, that deep inflammatory pain right inside the bone itself. So, how in the world did doctors solve this incredibly complex puzzle, especially when the clues can show up decades apart? It's kind of like trying to solve a medical cold case. Get this. In one documented case, a patient had skin problems for a staggering 38 years before the bone symptoms even started. And that is exactly why SAPHO is often called a moving target. A patient might have had severe acne as a teenager, and then boom, decades later, they develop this debilitating bone pain. It takes a really sharp-eyed medical detective to connect those dots and realize that these two events, so far apart, are actually part of the same chronic illness. One of the biggest clues in the whole SAPHO investigation actually comes from medical imaging. A bone scan can reveal this really telltale sign, a bull's head pattern of inflammation right in the chest. It is a super striking image, and when doctors see it, it's a huge sign that they are finally on the right track to cracking the case. A visual clue like that often leads doctors to a more formal checklist. To make a definitive diagnosis, they use these guidelines called Kahn's criteria. Now, the really important thing to note here is that you don't need to have all 5 SAPHO symptoms at once. A doctor can actually diagnose the syndrome if you just have one of a few specific combinations, like bone inflammation plus severe acne, or bone inflammation plus those painful pustules. Blood tests can also help solve the SAPHO puzzle. Now, there isn't one single test that just screams SAPHO, but doctors will look for general signs of inflammation in the blood. And, maybe more importantly, they'll run tests to rule out other conditions, like rheumatoid arthritis. It's a classic process of elimination, like a detective crossing suspects off a list until only the real culprit is left. Okay, so we know what SAPHO is, but the bigger question is still out there. What causes it? It's a total medical whodunit, and researchers are on the trail of a few key suspects. The leading theory is that it's a perfect storm of your genetics, some kind of infection, and an immune system that's just gone haywire. Think of it like a chain reaction. Your genes might make you more susceptible, then an infection comes along and acts as the trigger, which then causes your immune system to totally overreact. The result is a tragic case of friendly fire, where your body's own defenses turn against your skin and your bones. Let's dig into the evidence for each of these three culprits. So, suspect number one is a tiny microbe with a big reputation, Propionibacterium acnes. Yep, the same bacteria that's behind common acne. Researchers have actually found this little guy lurking in the inflamed bones of some SAPHO patients. But the case isn't exactly open and shut. The bacteria isn't found in everyone, and antibiotics often only give temporary relief. So, the jury's still out. The next clue is hiding in our DNA. Turns out SAPHO can run in families, which is a pretty strong suggestion that there's a genetic link here. Scientists have even pinpointed a few genes that might be involved, like one called HLA-B27, which is also linked to other autoimmune diseases. It's like they're following a genetic breadcrumb trail to try and uncover the secrets of SAPHO. And the final piece of this puzzle is the immune system itself. In SAPHO patients, the body's internal alarm system basically goes haywire. These alarms, called cytokines, are supposed to signal an attack, but in this case they just get stuck in the on position. It's like a fire alarm that will not turn off, flooding the body with inflammatory signals that just relentlessly attack the skin and bones. So for the people who finally get a diagnosis, the journey is really far from over. Living with SAPHO means learning to manage a chronic illness that can be super unpredictable, with these periods of intense flare-ups followed by times of relative calm. It can be a real roller coaster of pain, frustration, and just plain uncertainty. So where does SAPHO actually hit? Well, as you can see, the most common target by a huge margin is the anterior chest wall. A massive 91% of patients feel that deep, aching pain in their sternum and clavicles. But SAPHO can also attack the spine, the pelvis, and even the jaw, causing a whole wide range of really debilitating symptoms. Now, the tough news is that there's no cure for SAPHO, but the good news is there are definitely ways to manage it. Treatment is really a team effort between the patient and their doctor. The goal is to find a personalized plan to get the pain and inflammation under control. It's all about empowering patients to take charge of their health and live the best life they possibly can with SAPHO. You can think of it like a therapeutic ladder. Doctors will usually start on the first rung with simpler treatments like anti-inflammatory drugs. If that's not cutting it, they can move up the ladder to stronger medications like antibiotics, steroids, or even these powerful biologic drugs that target the root cause of the inflammation. The whole idea is to find the lowest rung on the ladder that brings relief, with surgery being a final option for only the most severe cases. So in the end, it makes you wonder, for a syndrome like this, with no cure and a diagnosis that's so hard to get, maybe the most powerful weapon we have isn't a pill or a procedure, but just knowledge. By raising awareness of this rare and complex syndrome, we can empower patients to advocate for themselves. We can help doctors connect the dots sooner, and ultimately we can bring hope to people who have been living in the shadow of this medical mystery.